So I'm going to just briefly talk about the types of surgery that are offered in many places, and you've probably heard of them. I'm just going to cover the three main ones. The first one is a gastric bypass, the second one is a sleeve gastrectomy, and the third one is an adjustable gastric band. So with the gastric bypass, this works in two ways. We create a small pouch in your stomach and then divert some of your bowel away so that your digestive system is actually shorter. So it works on restriction and malabsorption a little bit. The weight loss with the bypass is quite predictable in a sense that you will lose up to 75% of your excess body weight at a 2-year mark, with most of the weight being lost in the first year. It is technically challenging operation for the surgeons, but that's what they're paid for. It can be, there are risks with any surgery, bleeding, infection, leaks in the joins from your stomach to your bowel. But in the main, the surgery is very, very successful, and people do lose an awful lot of weight with it. Obviously, because you're taking in less calories and less nutrition, the calories that you choose have got to be quality calories. But even then, you are going to be nutritionally depleted a little bit. So you need to take multivitamins and minerals basically for the rest of your life. You'll also have to have a vitamin B12 injection every 12 weeks for the rest of your life. It's very, very important that wherever you have the surgery done, that the follow-up for these vitamins and minerals is kept up to. And you've got a responsibility to do that as much as your healthcare professionals have. So just moving on to the sleeve gastrectomy then, there's no involvement in bowel. We don't shorten your digestive system in any way at all. Essentially what we do is make your stomach a lot smaller. So we take about 7/8 of your stomach away and leave you with a small thin tube, which obviously means you can eat less. Again, you need to take multivitamins and minerals for the rest of your life, and you do have to have a vitamin B12 injection with this. Again, the same risks as with the bypass. There are risks of leaks to the staple line, but you will be monitored quite closely wherever you have your surgery for signs and symptoms of this. The third surgery that you probably heard about a lot is an adjustable gastric band, which is a silicone band that sits around the top of your stomach and works to restrict the amount of food that you eat. But because of the placement of the band, it actually sits and presses against a group of nerves that you've got at the top of your stomach that send a signal to your brain to tell you that you are full. So you will feel full much faster with a gastric band in situ. Every 4 weeks or so after the band is inserted, you need to have the fluid adjusted in the band. And in order to do that, the surgeon will place a port just sort of on the side of your stomach there that can be accessed through a needle. So if you're a little bit squeamish about needles, it might be something you need to consider. Fluid is adjusted in this band every 4 weeks until we get the level right for you. You will know that the level is right because you won't be searching for food in between meals, and you'll be satisfied on 3 small tea plates of food each day. Obviously, as I've said, there are risks with all 3 surgeries, and the benefits are different with all 3 surgeries. The weight loss is more dramatic and faster with the bypass and the sleeve. With the band, it's a little bit slower, and the weight loss is up to 50% of your excess body weight lost at 2 years. But all 3 have been extremely successful for people.